Depression is a real issue that affects people of all ages and backgrounds. It's estimated that more than 264 million people suffer from depression worldwide. For those who feel like they may be depressed, it can be an isolating experience that can have a profound effect on everyday life. In this post, we'll walk you through the basics of depression, including symptoms, risk factors, impact on daily life, treatment options, and when to seek help. We hope to provide you with the knowledge and resources to get through this difficult time. Let's start by taking a closer look at what depression really is. Depression is a mental health disorder characterized by feelings of sadness and/or a loss of interest in activities that were once enjoyable. It can manifest as a combination of physical and emotional symptoms, such as tiredness, difficulty, concentrating, insomnia, lack of motivation, and a lack of appetite. Depression can be short-term or long-term and can range from mild to severe. Depression can also have a serious impact on one's well-being and functioning, making it difficult to perform at work or school and to participate in social activities. It can also make it harder to handle stress and to connect with friends and family. That said, depression does not have to be a life sentence. Awareness of the condition can help individuals identify the warning signs and seek appropriate treatment. With the right support, it is possible to manage depression and live a fulfilling life. In this video, we'll explore the symptoms and warning signs of depression, the risk factors associated with it, impact on everyday life, treatment options, alternative treatments, coping strategies, self-care practices, and how to know when it's time to seek help. We'll also provide resources for seeking treatment. By the end of this video, you should have a better understanding of depression, the resources available to you, and the steps you can take to manage symptoms and get back on the path to recovery. Symptoms and warning signs of depression. Feeling depressed can manifest in a variety of ways. It is important to be aware of the signs and symptoms so that we can recognize it in ourselves or in our loved ones. Depression often shows up as feelings of sadness, hopelessness, and helplessness. This can include increased irritability, crying spells, and feelings of not being able to do anything right. It may also cause changes in appetite or sleeping patterns, lack of energy, or trouble concentrating. Physical aches and pains may also appear with depression. This can include headaches, stomach aches, or general pain all over the body. Other physical symptoms might be slowed movements or increased fatigue. For some people, depression can lead to distancing from friends and family, avoidance of social situations, or difficulty maintaining relationships. In addition, those experiencing depression may have difficulties with activities that they once enjoyed. It is important to note that depression looks different for everyone. If these symptoms sound familiar, it is important to talk to a mental health professional to get the help you need. Risk factors for depression. Depression is a serious and potentially debilitating mental health disorder. It can have a profound impact on individuals, affecting their physical and psychological well-being. Understanding the risk factors for depression is essential for people to be able to prevent or manage its onset. Depression can affect anyone, but there are certain factors that make it more likely. These risk factors include having a family history of depression, experiencing a difficult or traumatic event, living with a chronic illness or disability, certain medications, drug or alcohol use, being in a high-stress job or life situation, social isolation, and being exposed to negative thought patterns. It is important to note that having one or more of these risk factors does not guarantee that a person will develop depression, but it increases the chances. Research suggests that certain combinations of these factors may be particularly powerful in increasing the risk for depression. Impact of depression on everyday life. Depression can have a significant impact on our everyday lives, from our relationships with family and friends to our performance at work or school. It is important to understand the ways in which depression can affect our personal, professional, and academic lives. Relationships. When you are struggling with depression, it can be difficult to maintain relationships. You may feel exhausted or numb, which can make it hard to engage with others. Or you may become irritable and anxious, which can lead to conflicts with loved ones. Depression can also lead to feelings of isolation and loneliness, as well as an inability to enjoy activities that were once enjoyable. It is important to be aware of these potential impacts of depression on your relationships so that you can take steps to manage and improve them. Work and school depression can also have an impact on our work and school performance. It can sap the motivation needed to complete tasks, leading to decreased productivity. It could also cause difficulty concentrating, which can interfere with studies or on the job performance. Additionally, depression can lead to increased absenteeism, as well as a general decrease in enthusiasm for the tasks at hand. It is important to be aware of these issues and take steps to manage them in order to keep up with work and school responsibilities. Coping strategies. If you think depression is affecting your relationships, work, or school, it is important to take action. One way to do this is to practice self-care. This includes getting regular exercise, eating healthy, maintaining a regular sleep schedule, and doing activities that make you happy. It is also important to seek help if needed. Talking to a mental health professional can help you learn how to manage depression and its effects on your daily life. Diagnosing depression. Depression can be difficult to diagnose due to its wide range of symptoms and varying severity. In order to get an accurate diagnosis, it is important to seek help from a mental health professional. They will assess the individual's symptoms and examine their medical history. This may include one or more of the following methods. Clinical interviews. A mental health professional will talk to the patient to determine if they are displaying symptoms of depression. Physical exams. A doctor may perform a physical exam to rule out any underlying medical issues that could be contributing to depression. Lab testing. Lab tests may be used to evaluate hormone levels or other biological indicators. By examining these different factors, a mental health professional can accurately diagnose depression and develop a comprehensive treatment plan. Treatment options. When it comes to treating depression, there are a number of options available. Many people find that a combination of therapy and medication works best for them. That said, each person's experience with depression is unique, and what works for one person may not work for another. Talk therapy, also known as psychotherapy, can help individuals address challenging thoughts and feelings, learn healthier coping skills, and gain insight into their experiences. Cognitive behavioral therapy, CBT, is one type of talk therapy that has been shown to be particularly effective for treating depression. Medication can also be an effective form of treatment for depression. Commonly prescribed medications include selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, tricyclic antidepressants, TCAs, and monoamine oxidase inhibitors, MAOIs. It is important to speak to a doctor and mental health professional before starting any type of medication. Lifestyle changes can also help improve symptoms of depression. Exercise has been shown to reduce symptoms in some people, while changes in diet can also make a difference. Additionally, developing healthy sleep habits and making time for self-care activities, such as mindfulness and relaxation techniques, can help manage depression. Alternative treatments. Depression is a serious condition that can have a significant impact on a person's life. Fortunately, there are a number of treatments available to help manage its symptoms. In addition to traditional therapies such as talk therapy and medication, there are also alternative treatments that may be used to supplement traditional treatment. Some of these alternative treatments include acupuncture, herbal remedies, nutritional supplements, and meditation. Acupuncture is a form of traditional Chinese medicine that involves inserting thin needles into different points of the body. It is thought to improve mood and reduce stress by restoring balance and harmony to the body. Herbal remedies may also be used to treat depression. These remedies are typically made from plants and herbs that have been used for centuries to improve mental health. Nutritional supplements such as omega-3 fatty acids may also be beneficial in improving mood and reducing symptoms of depression. In addition to these treatments, meditation can be a helpful tool in managing depression. Meditation is a practice that involves focusing the mind on a particular object or idea in order to achieve a state of relaxation and clarity. Research has found that regular meditation can reduce stress, improve sleep quality, and reduce symptoms of depression. Although alternative treatments may be helpful in managing symptoms of depression, they should not be seen as a substitute for traditional treatments. It is important to consult with a mental health professional before starting any kind of treatment, including alternative treatments. The professional can help you determine if alternative treatments are right for you and provide guidance on how to safely and effectively use them in combination with other forms of treatment. Coping with depression. When you are experiencing depression, it can be hard to cope. It can feel overwhelming at times, and many days may feel like a never-ending onslaught of negative feelings and emotions. However, there are many ways to manage your depression symptoms and to improve your mood. Tips for coping with depression. Reach out for support. Don't be afraid to ask for help from friends, family, or a mental health professional. Connecting with others can help you feel less alone and provide an opportunity to share your experiences. Engage in activities that make you feel good. Pursue hobbies that you enjoy and bring you joy. Make time for yourself to do the things that make you happy. Reduce stress. Take time out of your day to relax and recharge. Find practical ways to reduce stress, such as exercising, journaling, and deep breathing. Prioritize self-care. Eat well, get regular exercise, and practice good sleep hygiene. Treating your body well is essential for managing depression. Try to maintain a healthy lifestyle. Avoid drugs and alcohol, as they can worsen symptoms of depression. Focus on healthy habits, such as maintaining a regular sleep schedule and eating nutritious meals. Stay connected. Stay in touch with friends and family through social media, phone calls, or video chats. Connecting with people who care about you can help you feel supported. Seek professional help. If your depression symptoms are interfering with your life, consider seeking help from a qualified mental health professional. Treatment options such as talk therapy, medication, and lifestyle changes can be effective in managing depression. These tips can help you navigate your depression and cope with the symptoms. In addition, engaging in these activities can also lead to greater overall well-being and improved mood. Remember to take your time and focus on taking care of yourself. Self-care and prevention. Depression is a serious condition, but it is possible to take steps to help manage symptoms or prevent depression from worsening. Self-care is an important part of any mental health plan and can help to reduce symptoms as well as improve overall well-being. Self-care focuses on physically, emotionally, and mentally nurturing yourself by practicing healthy habits. This may include eating nutritious foods, exercising regularly, getting plenty of sleep, having fun with friends and family, setting aside time for relaxation activities, and managing stress. Additionally, it is important to be honest with yourself about how you are feeling and to talk to someone if you need support. Researchers have also identified various lifestyle modifications that may help to prevent depression. These include maintaining healthy relationships, developing coping strategies, practicing mindfulness, staying socially engaged, and finding meaningful activities to do. Additionally, avoiding self-criticism, taking breaks from work, and giving back to the community have all been identified as helpful strategies. While there is no one-size-fits-all solution for managing or preventing depression, these strategies can provide valuable guidance and support. It is important to note, however, that if your depression persists despite self-care and lifestyle changes, it may be time to seek professional help. When to seek help for depression. If you've been feeling unusually sad or have lost interest in activities that used to make you feel happy, it might be symptoms of depression. It's important to recognize these signs and understand when to seek help from a mental health professional. It may be difficult to admit to yourself that you are struggling with depression, and even more difficult to open up to others. Although it can be hard at first, reaching out for help can be one of the best things you can do for yourself. Here are some signs that it may be time to seek help. Your feelings of sadness or hopelessness persist for 2 weeks or more. You are having trouble sleeping or not getting enough rest. You are having difficulty concentrating or focusing on tasks. Your appetite or weight has changed significantly. Your thoughts turn to self-harm or suicide. You are withdrawing from activities or people you used to enjoy. If you are noticing any of these signs, consider talking to a mental health professional who can assess your symptoms and work with you to create a treatment plan. Keep in mind that depression is treatable, and seeking help is an important step in managing it. Resources for help. When it comes to dealing with depression, having access to the right resources is invaluable. There are many helpful resources available to those who are struggling with mental health issues, including local support groups, websites, and helplines. Local support groups are a great way to connect with people who understand what you're going through and provide mutual support. These groups can usually be found through your local hospital or mental health clinic. There are also many websites dedicated to helping those who are struggling with depression, such as mentalhealth.gov, which offers extensive resources and information about treatment options. Additionally, there are many online support forums and communities to provide comfort and support. It is important to remember that help is available any time of day or night. If you are feeling overwhelmed or in need of support, helplines are available 24 hours a day. Some hotline numbers include National Suicide Prevention Lifeline, 1-800-273-8255. Crisis Text Line, text START to 741, 741, Suicide Awareness. Voices of Education, 1-800-273-TALK. No matter where you are or how severe your depression is, there is always help available. Reaching out for support is the first step towards getting better. Conclusion: depression is an often misunderstood and underestimated issue, but it is important to understand the symptoms, risks, and treatments that come with it. If you think you may be showing signs of depression, it is important to contact a mental health professional for a proper diagnosis and treatment plan. There is no one-size-fits-all approach to managing depression, but there are a variety of methods that may help ease symptoms, including talk therapy, medications, lifestyle changes, and self-care. Additionally, there are many resources available to those who need help. Reach out for support from friends, family, and professionals. You are not alone. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief.